The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Welcome to Mindful Moments. My name is Pedro Morante. I'm a dual board certified psychiatric mental health nurse practitioner and also a family nurse practitioner board certified. And we would like to welcome our highly esteemed guest for today. Let me start with Sasha Rarang and also Anthony Villa via Zoom.
Hello.
So for today, we talk about pride in practice, an empowered nurse journey, and also focusing on LGBTQIA community and mental health. So I would like the special guests to introduce themselves and tell us about your nursing journey.
Oh, okay. Thank you so much for that, Dr. Morante. My name is Sasha Rarang. I am a PhD prepared nurse, and I've been in nursing for the last 30 years. And currently, I am an educator, of course, a dean of nursing of one of the private schools here in Los Angeles, and recently graduated from my PMHNP. Especially with their mental health, because I know that looking at the ability of this community to be able to have a compassionate person to care for them in nursing, especially, is there's not much people in that area. So yeah, that's actually allowed me to go into nursing, into practice for mental health, PMHNP. That's the what influenced me to go here in this field. So there's a lot of things that I've done in my past as a nurse, of course, starting with pediatric nursing, medical surgical nursing, geriatrics, and all of that, case management as well. So as an educator, I'm enjoying my stint as an educator in nursing at this point in my life. Maybe I will see a patient maybe in the future to become a nurse practitioner, practicing mental health nursing, truly.
Thank you, Sasha. Now we go to Anthony Villa, who is actively practicing as a nurse practitioner too.
Hi, good morning. I'm Anthony Villa. I go by he, him. I have been a registered nurse since 2010. Kind of an extensive background too. I started on hematology, oncology. Then I went to the progressive care unit, case management, the ICU, and the emergency room. I went and obtained my MSN in nursing education in 2015. Decided that it was not for me, so I went back to school at Azusa Pacific University. Got my family nurse practitioner certificate. And started as a nurse practitioner in 2020. I currently work at St. John's Community Health, which is a federally qualified healthcare center here in South LA. I've been here for about 5 years already. I ended up specializing. So not only do I do primary, in family medicine, I also do PrEP for HIV prevention, PEP, which is post-exposure prophylaxis, hormone replacement therapy or HRT for our trans clients, and also recently HIV care. I am certified in HIV care as a provider.
Thank you, and wonderful experience for both our guests. And I would like to also welcome all our followers in the Instagram, TikTok, and also LinkedIn for those who are tuning in to this podcast. My first question for both of you is, it's not a Miss Universe question for sure. There's no crown on this section, but I would just like to dive deeper on your approach for caring for our patients. Statistically, there are high rates of suicide, depression, substance abuse among the LGBTQIA community. We would like to address this disparity. And the first question for both of you is that, how do you approach creating a safe and affirming environment for LGBTQ patients during psychiatric assessments?
Well, I haven't really had much patient interaction at this point because I'm a new grad, and my practice is basically when I was an intern. So what I've learned is that, of course, you have to make sure that you are culturally competent when you are dealing with any type of a patient, okay, especially with the LGBTQI community. There's a lot of sensitivity that needed to be given to them, especially when you are approaching them, making sure that you can develop trust right away with them, because of course, based on the stigma that surrounds the situation, make sure that they feel comfortable with you as their care provider or as the nurse practitioner, of course, attending to them. Based on that idea of establishing trust, make sure that you gotta ask them, how are you going to be addressed in this situation? Making sure that they don't feel embarrassed, because you can encroach into their personal space. So make sure to take care of that as well. So starting with establishing a trust, ensuring that you are patient-centered with your approach, identifying them with what they want to be identified with. Yeah.
Thank you so much for that, Anthony.
I think a really good way to start off with the interpersonal relationship is just to establish that trust. Um, you always want to make sure you're using correct pronouns, trying to minimize any judgments you have about any, risky behaviors that they may have. I'll tell my clients, as long as you don't plan on hurting yourself or hurting others, whatever you tell me is just between us. So I'm here to help you. No question is stupid. Because some of the stuff is scary for them. The medications have a lot of side effects. It's all about the trust at the end of the day.
And it's basically important. Therapeutic alliance, or patient should trust you, right? Other than the patient doesn't trust you, you are in therapeutic rapture, it's harder to create a connection with your patients, and makes harder for us to deliver our care for them. My follow-up question for both of you is that, what are some common mental health disparities faced LGBTQ individuals, and how do you address this in your clinical practice?
We are aware that the community is very much exposed or suffering from a lot of discriminations and, of course, bullying on some of our members. And with that, we know that they actually suffer from mental bruise. I call it being bruised because of the abuse that they experience in their lives. But not everyone, though. Some of us are very positive about our experience also with our lives. And so you have to get to know the person. And I think anxiety is one of the most common problem there. Depression. And of course, if they have depression, they have suicidal tendencies. And then we were talking about the use of drugs and substances, right? Substances. So we know that the impact of those substances, if you use them, definitely that person could possibly affected mentally, of course, and their neurological ability, the personality change. A lot of members of the LGBTQ community, about maybe 30 to 40%, are actually resorting to substance use. Because of it could be considered as a crutch in order for them to move on and go on with lives. And there's no judgment to that, because if you are in that situation, definitely you might also going to be using the same approach in order for you to survive. But we're not justifying that. It's important for them to understand that there's help, there's hope. And so when we see them, two things: take care of their mental health and take care of the use of substances.
Great. Thank you so much for that, Anthony.
I do agree that trying to be as judgment-free as possible is very beneficial. Members of this community, just because, they face so much stigma, family members, friends, or, members of the public. The last thing the patient needs is for their provider who, is supposed to make them feel or provide a safe space for them, make them feel like they're discriminating or disappointed in their behavior. A lot of the times we forget that a lot of members of the LGBTQ population have had adverse childhood events, and as we know, the higher the ACE score, the more chances of psychiatric comorbidities, trust issues, developmental issues. So I think at the end of the day, it's just fostering that safe space for them.
Thank you, Anthony. And think a lot of our patients needs to feel welcome, and they need to feel safe, and they need to be seen, validated, and heard. Okay. And they're a beautiful human, right?
That's right.
Yes. How do you incorporate gender affirming care principles into your psychiatric treatment plans?
Well, when you start with the plan, make sure that you assess properly the person. You have to collaborate. You as the provider and the person, what are their aims or goals with this one? Of course, you start with, the age of the person, depending on the age, and we know we have to follow the guidelines. I don't know about our colleagues here, but of course, more likely you have given all those hormone replacement therapy or hormone therapy to transitioning individuals. But one of the concern here about children that are diagnosed and with gender dysphoria, and when they're trying to transition, the most common question is how early you can transition, right? And that's a big debate right now. But actually, if you follow the guidelines, when the person, let's say, the individual is 16 years old, it's more likely it's the right time for you to determine the path. Okay, but before that, of course, we have some medication that we could give the patient to prevent them from starting their pubertal development, and so that will lessen the anxiety that the person could feel, by having all this development, and they think that that's not what they feel like. Because they can perceive themselves as, okay, I feel like I'm a woman, but then why I'm having all this masculinity developing in me. So, and of course, the support of the parents. When it comes to gender affirming, we have to make sure that it should be individualized. Look at what the hormone can do. There's a lot of types of affirming, of course. We're not just talking about hormones. We're not just talking about surgery here. We're talking also about social affirmation and legal affirmation, things like that. So maybe we have to start there, okay? And then for the medical affirmation, of course, the use of hormones. It's important. A lot of, especially with children, we have a lot of side effects in this one. So we don't want to start too early. Okay, it should be the right age. Tanner 2 is when you kind of start. So you have to assess that, making sure that we're on the right age for the person. And psychologically, I'm not really sure right now if we're in the standards, if they're still using psychological preparation for anyone who's actually trying to transition. I'm talking about the transgender individuals here. But during my time, we had the opportunity to go for at least 3 to 6 months to validate our concerns psychologically, mentally, that we are not just pretending that we want to transition and then tomorrow we're changing our mind right about it. So that was way back in the early 2000s. And then when I went to hospital again for another procedure, and then they did the same thing. They have to psychologically evaluate you, condition, your perception, your thoughts, things like that. Because of course these are irreversible. So yes, it's very important to perform a thorough assessment, physically, mentally, psychologically, when you start transitioning.
Great insights. Anthony, in your practice, how do you do this gender affirming care principles?
I think the biggest factor of this is the assessment process. As nurses, we are responsible for assessing, coming up with a plan and interventions based on those. For a lot of people, it can be really uncomfortable asking really hard, heavy personal questions. No matter the individual, I always ask them, their pronouns. Um, I always ask a sexual history. I ask about substance abuse. And using uh, non-accusatory language like, hey, I need to ask you some really personal questions. It's part of the protocol, and there's no judgment here. Thing that I've learned as well is it's all about harm reduction. For example, I may have a client that has HIV and is a transgender individual. They might just be showing up because they want a refill of their hormones, but you notice that, their viral load is through the roof. And you kind of just have to have that conversation like, hey, like, listen, you know, I don't want this becoming more serious, developing into AIDS. I know hormones are important to you. Can we do like a 30-day supply of hormones and can you come back so we could just assess how you're doing? Um, kind of just trying to barter a little bit with their health so you can ensure that, they do return. Because a lot of our clients are lost to follow up. That could be from a myriad of things: homelessness, substance abuse, transportation, distance from the clinic. So we always need to kind of keep that in mind, especially when, we're doing our initial assessments.
Thank you, Anthony. And I think we have to do like an individualized approach for them. And that's what we're boiling out here. And we always follow the nursing process, identify their physiological needs, make sure they're safe, and make sure we're able to cater to all what their concerns are at that visit. And those are very important. My follow-up questions for you is, can you discuss the role of minority stress and its impact of mental health among the LGBTQ populations?
Dr. Morante, it's very common to suffer from the idea of discrimination, as well as the lack of support to the LGBTQ community. And I think these are the common reason for minority stress that we are seeing. The discrimination, the bullying, things like that happens almost every day in their lives. So when someone is exposed, of course, based on our assessment, we have to ask all the history during the history taking. Okay, the family background of your community. Where do you live? Who are you with? We're forgetting that some of them also have relationships, things like that. How much support are they receiving from this support system, supposedly? Is that discrimination really affecting them mentally? So if it does, definitely they will resort to more of a problematic situation, like the use of drugs. So these minority stress that we're saying actually have a full impact into the physiological, mental attributes of this individual that we are talking here. So it's very important to consider that part of the assessment again, the minority stress. So again, we're gonna go and not to judge them, okay? See if there's any hope that we could provide them, okay? Guide them to the right path if possible. Of course, every individual have their own right to determine what they want to do in life. And I heard about the housing, the transportation, all that. Those are all effects of the lack of job opportunities, another problem that is caused by the minority stress here.
Great. Anthony?
Minority stress is really important to be aware and mindful of, especially for, you know, people of the LGBT population. It's heavily tied to stigma, and it's usually years and years that the client has been dealing with it. And they put up barriers. They don't want to be vulnerable. It kind of, destroys their spirit. The short visits that I have, at least, 15 to 20 minutes with the client, it's hard to even scrape the surface of the stress of being a minority. So, trying to tailor our interventions, barriers in mind, just to better help them because, at the end of the day, they experience a lot.
Thank you, Anthony. And I think a lot of patients can feel like trauma, bullying, discrimination, and could start from their families, from the schools, could start from the community and churches. So we just need to make sure we are sensitive about this topic, and we need to make sure that they are seen, heard, and validated at all times. What strategies do you use to assess and manage the risk of suicidality and self harm among our LGBTQ population?
I think it should start the same as when we are assessing our patients and regular patients. I would say the cisgender patients. We gotta ask them directly. Do you have any thoughts of harming yourself or killing yourself? And based on that question, using therapeutic communication to assess further, okay, how do you feel about this? And, more likely they will gonna give you an idea of how they feel. Okay, of course you have to ask them about any signs. You have to assess them about signs and symptoms of depression using different tools, definitely. Your PHQ-9, things like that, GAD or GAD-7, depending on the situation that you see on a patient. But more likely, you gotta use some tools to determine where they're at. A lot of the depression I see among us, that's unfortunate, but it's the reality. And if they're using drugs, then we have to also use other tools to determine if where are they at this point.
Great tools.
Yeah.
Anthony?
I do agree. Assessment is really, really key. The majority of our clients, if they're LGBTQ or not, they do get screened for ACEs. Based on those results and further assessment and workup, talking to your client, we can determine, if they need those tools like the PHQ-9 or the GAD-7, being aware, being mindful, trying to approach asking questions from different perspectives or different ways. For example, I'll ask a client, hey, like, do you have any medical issues you want, in your history? And they'll be like, no. I'm like, okay, any mental health concerns? Do you take any medications? And they'll say no. I'm like, okay. And I'm like, wait, well, I do take, Wellbutrin. Okay, you take Wellbutrin. Like, what do you take that for? Can you tell me more about it? So kind of just always kind of keep the door open, asking kind of direct questions so they can have some room to answer. I found that's a really good strategy for that.
Great. Those are wonderful interventions that you guys have been utilizing. And I think we can ask focused questions, close-ended questions for them. Assess also their protective factors. That's very important. Do they have any access to weapons, guns, or anything that they can use to hurt themselves or hurt others? And those are things that we can address. And those screening tools are important as a providers to utilize in your clinical practice. I'm learning so much with this conversation for both of you. I'm so proud of all your answers and so informed about this. My follow-up questions is, how do you stay informed about the evolving terminology and issues within the LGBTQ community to provide a culturally competent care?
I think by being in tune with the different organizations in nursing alone, like for example, the nurse practitioner, the AANP, okay, they provide a lot of information with regards to how to care for patient in general. But of course, specific population, just like the LGBTQI plus, and GLAAD, the GLAAT website. Okay, because I've been doing some research actually with regards to the LGBTQI community, and I use those websites like the Trevor Project also has to be included as your resource. So learning from those, and then of course organization like my own organization, the local organization of the Philippine Nurses Association of Southern California, and of course the Philippine Nurses Association of America, they provide a lot of webinars, and I'm actually as a part of the DI, I'm the chair of the DI. We did that for a while by reducing what you call this stigma to this population. And so during that opportunity, during those webinars as well as seminars, conferences, we were able to look at the current trend, and the WPATH guidelines will really help you how to approach a person in terms of their treatment. So yeah, it's important for us to be updated to our organizations, to our profession, so professional organizations. Yes.
Thank you. Anthony?
Yeah, I think professional organizations are really great resources. In myself, I'm accredited by the American Academy of HIV Medicine. I do use their website and education materials a lot. There's other organizations as well, such as like Fenway Health,
Yeah.
that they're experts on transgender care. They have a lot of resources that are based on the WPATH, World
Yes.
Professional Association
Professional
for Transgender
health.
Health.
Yes.
Um, and I also learn a lot from my clients. I've learned that, were you born a boy or a girl? It's not necessarily correct. It's either assigned male at birth, which is AMAB, or assigned female at birth. So you learn a lot of terminology that's really helpful, to your other clients that you come across that, may fit the situations.
I love those resources, and please, to all the providers out here, please check them out, okay? And we'll send out some links in this podcast for all the resources that you guys can use. And also your local LGBTQ websites or support clinics are there too. Okay. Describe your experience working with transgender and non-binary patients in regards to hormone therapy and psychiatric care integration.
That's a good question. So when it comes to my transgender non-binary clients, it's really important for me to, start by asking their pronouns. What gender identity do they identify with? Have they been on hormones before? What regimen, if so? Being mindful of their comorbidities, especially psychiatric ones. Do they have bipolar disorder, or do they have a personality disorder? Are they on something that might pose a risk to their health? For example, we know that there can be an increased risk of venous thromboembolism with estrogen therapy. And if they have, you know, um, let's say schizophrenia or bipolar disorder and they're taking a typical antidepressant, that could predispose them to obesity or diabetes or high blood pressure, which then increases the risk of developing a blood clot. Um, so we always want to kind of be mindful and assess for different interactions. always assessing if they're taking the medication correctly as prescribed, double checking if they have access to mental health resources. Some of them, they haven't seen a psychiatrist or a primary doctor in years, and they used to be on something, but they haven't, and they're reporting that their mood has been labile. So it's kind of just, talking, assessing, and seeing, the client as a whole.
Thank you, Anthony. Those are wonderful tips and interventions that we can definitely apply with our clinical practice. Do you have any follow up or any additions to that one, Sasha?
Yeah, I think based on experience, of
Mhm.
course, the follow-ups with the client, to about their health. Labs is important for you to determine, because that's always been what my endocrinologist is going to ask me. Come on in now because we need to check your levels. And I was like, okay. And we're so busy, and of course busy with work and all that. But it's important because, again, we are if you are on hormones, you are subject to obesity, your blood pressure. Oh, one thing that I've learned also is that it can affect, of course, your gallbladder. And the next thing you know, they're removing your gallbladders because, and I asked the doctor, I was like, why is it that we're developing stones? And it's like, well, don't you know that you're on hormones? And wow, that's something that, didn't cross my mind until I hit the reality that, wow, having been in hormones for 25 years, now it's just right time, of course, that, as you grow older, all of these things that's happening when you grow older will going to be impacted also by you being on hormones. So, but yeah, big follow-ups, making sure that they have the opportunity, the means to go to the clinic, and motivated to go back, because I think that's the hardest thing to do among these clients is continuity. Yeah. So we have to make sure we know how to how to motivate them to come back. Yes.
Great. Follow up and surveillance are very important, and those are things that we really need to be on top of. And case managers and also nurses that are helping us out with follow up are very important. My follow up question is, how do you collaborate with other healthcare providers and community resources to support the holistic needs of our LGBTQ patients?
It's all about collaboration with, make sure that you know who are the doctors attending to this particular person. For example, you see the person in your mental clinic, coming for a mental clinic psych evaluation. Like what our colleagues here are saying, if you find out that, if based on your assessment, you find out that there's other issues, for example, physical problems, then make sure that, see if do they have a specific doctor that they are they're seeing, for example, endocrinologists, urologists, things like that, and connect with those individuals to support the plan for this particular patient that we have. Always connect. And then, because we are on the adjacent situation here, we are not in you need to make sure that you have the primary care physician, the doctor or the nurse practitioner involved in this particular individual.
Yeah, I do think it's all about collaboration, putting your ego aside and, talking to other people. I talk to my peers all the time, like, hey, I have this situation, like, I'm gonna do this, but, am I missing something, or would you do something else? We do have access to case managers, um, especially with our HIV clients, that also help to try and, get transportation with the clients for their visits to ensure that they're, routinely following up. If they haven't been seen and they haven't been on their medication for, days or weeks or even months, like, we have a walk-in policy, like, hey, come and walk in and we'll make an accommodation to see you. So it's always just constant communication.
I think that's the key. All about collaboration, all about communication, and we're all in this together. We're not competing, but we're working with the patients side by side with the patients at all times. What challenges have you encountered when addressing substance use disorders within LGBTQ populations, and how have you addressed this barriers to them?
Well, I might not be the strong person about this substance use because I don't have much experience with regards to substance use. But I do know, of course, personal wise, I have some friends that actually a member of the transgender community, and I know for a fact that they've used some substances. I'm not sure which one, but I always tell them in my personal approach to them that, girl, you think that's the right thing to do. This is coming more from an advice of a friend rather than a care provider, because they don't want to hear you be a care provider at that point. They just want to hear a friend advising them what to do. And so that's what I do. Listen, if you have a situation going on right now, I'm here to listen to what's going on with you. But if you could possibly not to dwell into this use of this certain substance that you're using, because it's not going to help you. Remember, you are on hormone, you are on this medication, and this will going to add to the side effects that could you are experiencing, or could again may occur if you don't take care of yourself. So yeah, substance abuse generally is common, and we are thankful that we have a strong will to not to go to that during the time that we are also transitioning, and we know that nobody understood who we are. But I prayed a lot that I'm not going to be strayed, and I don't want to see myself like those people on the streets, because I know for a fact that we're not going to go anywhere if that's the situation. So you can ask them to, to be with you, guide. And the reason why I'm role modeling is because there's hope. Again, I'm here. Look at me. I'm not being, the big. I'm not the person here trying to, to know everything, but we can work this out together. If we can actually make our community in a better light, people can perceive. But of course, we don't worry about other people's perception. But it's important that you take care of yourself for your own good. So that's the reason why we want them. We want to motivate them to get out of that, if possible. No drugs, if possible. But we cannot just go ahead and easy to say than done, right? So slowly but surely we can help our community to get out of that. Okay, you're printing on something.
Thank you. Anthony, would you like to piggyback with that?
Yeah, I am still new to the field of medication assisted treatment for substance abuse disorders. I do have some clients who are on naltrexone, the oral or the Vivitrol injectable form, Suboxone, and it's always about assessing, history, how much, what they use, and kind of just listening to their story. Like, I had a client that I found out they had scoliosis, and they just kept on getting prescriptions for Norcos for like 10 plus years. And, they were here because they need help trying to get off of that, and they don't want to be on it every day. So, it's just kind of about being open, listening to what they have to say, and then using, our medication and other tools like counseling, group therapies to kind of help subside that use.
Thank you so much, Anthony. Those are wonderful insights and also response that we need to address for our patients. And I think as a provider, we continuously learn and also apply this evidence-based practice guidelines that we can incorporate with our clinical practice. Sasha and Anthony, how do you advocate for LGBTQ mental health awareness and reduce the stigma within our healthcare settings?
I would say that education of the community, just like the last 2 Saturdays, I did that with the Calmesa grant project together with the organization, and also webinars in the past 2 years. We've been providing the community of nurses to begin with, okay, on how to approach patients from the LGBTQ community to lessen the bias that we have on our own as providers to begin with. We call that our implicit bias, right? So we did that for webinars so that nurses and advanced practicing nurses will have an idea how to approach the community, especially transgender ones, especially. And for the last 2 weeks, I've been with the team. We're talking about taking action about your mental health, and aligning actually mental health and being a member of the LGBTQ. What are those mental health issues that we are experiencing? And we already know that a lot of them could be anxiety, depression, and even if they really have bipolar disorders, things like that, which is it could be also a problem, of course, depending on the patient background. And then schizophrenia is another thing that, but more likely anxiety is the very common theme that we see in the community, just like anyone else. So how do you lessen that? And of course, this coming from the stigma, the depression. So help them with that. So meditation, we teach them how to think the positive way with regards to self-care. Okay. And so that's what we tell the community, to support these individuals because they are part of our family, they are part of our society, and we want them to become productive as well. Be back in the community and be a productive member of the community. So that's what we do. That's what we did.
That's great. And those projects were successful. So congratulations
Thank
for
you.
that one. Anthony?
I think it's all about, you know, communication, knowing what resources are out there. I know that at my clinic, we have a behavioral health department that's always available for warm handoffs. Our transgender department, they always are out and about, like at festivals, promoting organization, advocating for what we do. So it's kind of all about, networking, what resources are available, and just, being there for our clients to listen. Sometimes they don't want medications, or they don't, you know, all they really need to is someone to listen.
Thank you, Anthony. Those are wonderful insights. And once again, we are learning and also continuously growing with this profession, which I'm so proud of both of you for doing this advocacy and platform and for everything that you guys are doing. And in the future, we can have more events and podcasts like this or talks that we make it available to the public, and also making sure that they are, for those who are afraid to come out there to seek mental health, what is your call for action for them, Sasha?
I would say that if you are worried about your blood pressure, think about mental health as your blood pressure. That it is normal to take care of your mental health. So whatever stigma that is connected to the idea of mental health, try to lessen that to a minimum degree so that you can take care of yourself. Because like what we did at Take Action, your mental health, don't only take care of your physical health, your mental health is part of who you are. So if they hear that, then they'll say, oh, yeah. And we're actually working on first aid for mental health as well. So this will benefit our community. If one of us will be able, few of us will be able to learn how to handle them and be in the community, actually firsthand in the community, to support them. Just like what Anthony was saying, just to be there to listen. And it will create a long way for our community members to be supported.
Yeah, I think, there definitely needs to be more public health education, mm, maybe even in the school system, that mental health is important. And, don't be afraid to ask for help if you're feeling, like you're drowning or you're anxious, it's okay to ask people for help, to go find help. I definitely think that there is, still a mental health crisis, and we need more funding and more, research and support, and just open-minded providers that can just help our clients.
Those are interventions that we can apply, and also definitely if we are joining collaborative efforts together, we can definitely disseminate this and make this an impact to the community of the LGBTQ. And anyone who is needing support, we're always here for you. So our call for action probably is what I'm hearing from both of you is like non-judgmental attitude, making sure that we practice gender affirmation, and making sure they're seen, they're heard, and they're welcome, and they're loved. And those are important. And also, we want to make sure that we are not contributing to their trauma. We need to be making sure that we validate all their feelings. And we often see on the social media that, hey, I'm posting about my career, about my house, about my achievements. I bought this, bought that, a lot of properties, but we don't talk about what is our mental health. I
That's
think
true.
it should be
That's true.
discussed on the table that a lot of people will be shy and not talk about it. They want to think that it's a sign of weakness. But for me, I think we need to normalize it and destigmatize this.
Correct.
And it start with self-awareness.
That's very true. Two things here that I would like to convey to our listeners or viewers. Mental health. Mental health is very important for us to consider as part of who we are. And we should take care of our mental health in order for us to have a good health and life to begin with. Second is, for the LGBTQI plus community, we need to make sure that it's just your unconditional love to your family members who are actually members of the LGBTQI. We should support them, respect who they are as person, and I think if we do have that ability to respect one another, all of these things that we're discussing here right now that actually not positive at all to both sides, whether the person involved and to the community and the member of the society, it will lessen the trauma that all of us are experiencing, because in the last few years, we've been more traumatized than it used to be. And it's really difficult to navigate nowadays the society with regards to what should I be putting out there. Should I not express myself? And so that's, in a way, is curtailing your freedom as a person, as an individual, because you can no longer act and express yourself as who you are in the right way. so so I just want to make sure that we are all supporting one another, because in a way we're all human beings.
Wonderful. Anthony?
If you're a medical or a mental health provider, you know, to just keep, in your practice, a safe, non-judgmental space, and to, make sure that we check in with ourselves to acknowledge any, implicit bias that we may have, and ask for help. Even the provider can ask for help. We also forget that what we do can be stressful, and we want to make sure that we're not, taking out our frustration um, on these members of this community who already face so much stigma and bias out there.
Thank you, Anthony. And to all the listeners out there, mental health is wealth, and make your mental health as a priority. And to all our LGBTQ plus community, know that you are loved, you are seen, you are heard, and you are not alone. Always remember you are a beautifully made human being, and we are all in this together, and we care for you. Thank you so much, Sasha and Anthony, two empowered nurse practitioner providers that are creating an impact and wonderful advocacy for both of you. Please continue what you're doing. And I hope that we can have more episodes like this to educate our viewers and also our followers. So please tell us, what are your upcoming projects, Sasha Rarang and Anthony, and where can they follow you in your social media?
I might be collaborating with some of the LGBTQ centers in the future. That's my plan as the future president of the PNASC. I just attended the get together of the members of the San Gabriel Valley LGBTQ Center about a week ago, and I see that there's a need to collaborate with them. Okay, so yes, there's a lot of things to going to be happening in the future. The next probably 2 years, the advocacy will continue, and hopefully we could write something about this that we could provide to our colleagues for them to learn about gender affirming therapy, and how does it help with mental health of transgender individuals. So yes, thank you. Thank you for the opportunity to be here.
Yes, I'm so glad to share this space with both of you. I'm so glad, Anthony.
Yeah, right now my time is kind of preoccupied with work, and I'm also pursuing a psychiatric mental health nurse practitioner certificate. So I'm kind of preoccupied with that. I will finish this fall, so by November I'll be done with that, and hopefully I can do more to advocate to anyone that is standing up and protesting ICE. I commend you. Just please be safe. Please be nonviolent. Our actions speak louder than words. If you want, you can follow me on my Instagram. That's Antney 007 ANTKNEE 007.
Thank you, Anthony. We'll be doing more projects like this, and I'm so honored to share this space with you once again, and so humbled that both of you had a collaborative joint podcast with me. So I'm so proud of both of you, and you guys will be doing great with this platform.
I would like to thank Dr. Morante for inviting me here at BD Bump to talk about mental health and how does affect the members of the LGBTQI community. Thank you again. It's been a pleasure talking with you. And talking to you and to Anthony in this podcast. It's really a great opportunity. It's wonderful to be with you.
Thank you so much, Dr. Sasha Rarang, for sharing this space with me.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.